Assalamu alaikum. Hope everyone is fine. Today we are starting on with the first lecture of the biochemistry series, and it's we have chosen liver. So today, first we are going to discuss about the normal liver functions. Once everyone know about the normal liver functions, so he can diagnose in the case of any disease if there is any abnormality. A lecture will include the normal liver functions, synthetic function of the liver, metabolic function of the liver, excretory function, and the detoxification function of the liver. It's my brief introduction. I have done Bachelor of Eastern Medicine and Surgery from Hamdani University, and I'm practicing Tibet Unani since 8 years and belong to a family of Unani physicians. Normal liver functions include synthetic function, metabolic function, excretory function, and the detoxification function. Moving towards the first function, that's the synthetic function. We are going to discuss about the synthetic functions of the liver. Synthetic function of the liver include protein synthesis and the coagulation factor synthesis. Liver produces proteins and coagulation factors. The synthetic function of the protein is that it is the principal site of synthesis of all circulating protein except gamma globulins, which are produced in reticuloendothelial system. Plasma contains 6 to 8 mg per dl of protein, mainly in the form of albumin, globulin, and fibrinogen. Liver also synthesizes complement factor, transferrin, hepatoglobulin, keroplasmin, carrier protease inhibitors, alpha-1 antitrypsin, and alpha-3 fetotrypsin. Albumin has half-life of 16 to 24 days, and 10 to 12 mg is synthesized daily. Its main function are to maintain the intravascular colloid osmotic pressure and to transfer water-insoluble substance such as bilirubin, hormone, fatty acids, and drugs. Albumin synthesis is reduced in chronic liver disease and malnutrition. It can be lost in nephrotic syndrome and in protein-losing enteropathy. Hyperalbuminemia results in edema. The synthetic function of the liver, which includes the coagulation factor synthesis. The coagulation protein, liver also synthesizes all coagulation factors other than factor 8, such as fibrinogen, prothrombin, factor 5, 7, 9, 10, and 12. Deficiency of coagulation factor result in bleeding tendency. Now we are going to look over the metabolic function of the liver. The metabolic function of the liver includes carbohydrate metabolism, fat metabolism, and the protein metabolism. First, the carbohydrate metabolism, how the liver metabolizes the carbohydrates. Liver is the main source of plasma glucose, as it is the main body storage site for glycogen. In the fasting state, glucose is derived from breakdown of glycogen, glycogenolysis, and gluconeogenesis, formation of glucose from amino acids and fatty acids. The most important note, liver damage can lead to hypoglycemia. How liver metabolizes the fat? Liver synthesizes the triglycerides, cholesterol, phospholipids, and lipoproteins. The protein metabolism. The liver is central organ in protein catabolism and synthesis of urea formation. Ammonia is produced by the degradation of amino acids that is converted into urea. Urea is secreted by the liver into plasma for secretion by the kidney. This is the major pathway for the elimination of nitrogenous waste. Note, ammonia level becomes high in severe liver disease that is harmful for brain and may lead to hepatic encephalopathy. Now we will discuss about the excretory functions of the liver. It includes bilirubin metabolism and the bile acid metabolism. First, we are going to discuss about the bilirubin metabolism. The bilirubin metabolism includes that bilirubin is produced from the breakdown of mature red blood cells, of Kupffer cells of the liver, and in the reticuloendothelial system. Bilirubin is formed from heme after removal of iron. This bilirubin is reduced to form bilirubin. The bilirubin produced is unconjugated and liver insoluble and is transported to the liver attached to albumin. Bilirubin dissociates from albumin and is taken up by the hepatic cells, where it is conjugated with glucuronic acid and is excreted in bile. Note: in liver disease, there may be obstruction to excretion of bilirubin manifesting as jaundice. This conjugated bilirubin enters in intestine within bile and is not absorbed because of its large molecular size in the terminal ileum. Bacterial enzyme hydrolyze the molecule, releasing free bilirubin, which is then reduced to urobilinogen. Some of this is excreted in the stools as stercobilirubin, and the remainder is absorbed in by the terminal ileum, passes to the liver via enterohepatic circulation, and is re-excreted in bile. Urobilinogen bound to albumin enters their circulation and is excreted in the urine via kidney. Now, the second excretory function of the liver includes the bile acid metabolism. The bile acid metabolism includes urobilinogen bound to albumin enters the circulation, is excreted in the urine via kidney. Bile acids are synthesized in hepatocytes from cholesterol. They are excreted in bile and then passes into abdomen. Bile acids are detergents causing fat solubilization that is necessary for absorption of lipids and lipid-soluble vitamins such as vitamin A, D, E, and K. Note: decreased excretion of bile salts in liver diseases causes pruritus, bleeding disorder. Deficiency of vitamins such as vitamin K leads to decreased formation of vitamin K-dependent coagulation factors, resulting in bleeding tendency. Steatorrhea, fatty tissue stool due to fat malabsorption. Now we'll discuss about the detoxification function of the liver. Liver plays a vital role in detoxifying nitrogenous compounds derived from intestine, as well as many hormone, drugs, and chemicals.